Good afternoon. I'm Dr. Kumar. I'm a spine surgeon. I work for Jeddah National Hospital in Jeddah. I'm here today to address to the public on a very important topic along with my team members who are here. We all know that every day in a year's calendar has been tagged to some event or celebrity or an occasion. We are familiar with Valentine's Day, Father's Day, Mother's Day, Nurses Day, Doctor's Day. In this armamentarium, certain diseases are also being given a special slot so that we all will remember, talk about it and spread the message so that we develop an awareness about the disease, about its prevalence and the consequences. The reason why some diseases have been included in this list is because they are so prevalent in a community and we all don't know, and they have devastating complications which, if we don't pick up early enough, are really catastrophic. We know about the Diabetic Day, Tuberculosis Day. We know that millions and millions of people have died from tuberculosis in the past. Still, it's on rampage, affecting lots of people and draining out our resources. Similarly, diabetic has been prevalent so widely and it is on the ascent and it is conquering the entire world. In this list of diseases, there is one special distinctive spinal disorder for which we have gathered together, and the world remembers this on 27th of June, and that is scoliosis. 27th of June is the International Scoliosis Awareness Day. That is why we are all here to talk about it. Many of you may be familiar with this word scoliosis and what it means. For those who do not know about it or those who have not heard about this word, let me tell you what is scoliosis is. Spine is the backbone of the skeletal system which forms the main stream of the trunk. It starts from the base of the neck to the base of the bottom. If you draw a line from the center of the head to the center of the bottom, it's plumb straight. This is how a normal back should look like. But for some reason or other, if the spine is deviated to either right side or left side, that's how the back is going to look like. It is curved, deformed, and the body is not centered. This is what scoliosis is. Why should we celebrate this as a special occasion? That's because it's so prevalent. Globally, if you look at this condition, the prevalence is about 0.5 to 5.5% across the globe. On an average, 3% of children at school going age or adolescent age are affected by this disease. When it starts, the male is to female ratio is almost the same, but when they reach skeletal maturity at about 17 years of age, the girls are 7 times more affected than boys, and 7 times more number of girls go for surgery than the boys. The mean angle at which this deformity is picked up by screening programs is about 38 degrees in the Western community. If you look at Saudi Arabian figures, the prevalence is the same. It stands at 3%. At the onset, the male-female ratio is slightly more among females, and at the time of skeletal maturity, it is about 8 times more common than boys. But the striking difference is the severity at which the disease is picked up in Saudi Arabia is 58 degrees, which is far more than rest of the developed world. That is why we are very keen on spreading this message and making the community to be aware of this. This is usually done either at school by the teachers or at home by parents, mainly the mother. But then, over a period of time, the statistics has shown that it's often missed by the parents because the patient herself, she cannot pick up because the deformity is in the back, and nobody can look at his or her back unless others notice it and point out. So, picking up by mother or parents at home is highly questionable. In 1984 in USA, this problem was identified, and the Academy of Orthopedic Surgeons, they issued a statement to the government that school screening program has to be started. But then in 1992, they made it as a legislation. Now 21 states in US, it's mandatory that the school program has to be implemented, and the teachers are the one who are reporting the cases. Initially, Europe was shied away from the responsibility, but now in 2013, it has become a legislation in most of the European countries that school health program to identify scoliosis must be implemented. That's the reason we thought we all should take it seriously and launch this program for awareness. Now, what exactly scoliosis causes? If you look at this, once the trunk is deformed, the neck is deformed, it deviates from the midline, shoulders are not leveled, the pelvis is not leveled, so one leg becomes shorter than the other, and a girl or boy who is affected by scoliosis will walk with a limp, and one side of the chest is very prominent, it's projected out, and the other side is sunk inside. Now this is the major problem in scoliosis. If you look at the curve here, and this is the CT scan of the chest, you can see that the right side of the chest is almost compromised. There is not much of lung left, and the left side is wide. So what happens is, this patient over a period of time will develop asthma or restrictive lung disease, and the breathing ability will gradually decline. One of the major causes of death in scoliosis at late age is because of respiratory failure. The clue for identifying scoliosis is this rib hump. Now look at this girl. If you look at her back, it almost looks normal. You might think that this back is normal, there is no problem. But when you make her bend forward, then the scoliosis appears, and that is a very important deciding factor in diagnosing scoliosis. Right? So how do we approach this condition in a hospital level by physicians? The first step is we identify how severe is the deformity. We identify the upper end of the vertebra and the lower end of the vertebra in the curve, and then we calculate the angle. Here it is 78 degree. Now if the angle is less than 20 degree, we don't have to do anything. Nothing is needed much other than gym activities, swimming, hanging on parallel bar, simple things, and then keep an eye on the child. If the angle is between 30 and 40, then we have to correct it with special braces. This has to be worn from the time we identify until a girl reaches skeletal maturity, which is about 17 years of age. Once it crosses 40 degrees, then surgery is the only option, and the surgery is very major, very destructive, but it is mandatory, it has to be done. Right? Now, if you look at these figures, there are three images which only the difference is the angle is different. If it is less than 20 degree, we do nothing. If 20 to 40, we apply brace. If it is more than 40, we have to go for surgery. Now, it is a simple negligence which pushes a lady either to go for this or that or this. So, whose responsibility it is? The teacher and teachers in school who are very close to the children, they have a responsibility to identify this. At home, mother plays a big role in recognizing this problem. And when a child comes to a hospital, the doctors and the team has the responsibility to identify. So we all have the responsibility to save our children from this disease, and let us all spread this news and create an awareness in our society. Thank you.